of Rwanda, and that is Dr. Daniel Ngamije. He will also be joined by Professor Agnes Binagwalu, who is the co-chairperson of the second International Conference for Public Health in Africa. And she's the co-chair of the scientific committee of that conference. And she has been for the years 2021 and 2022. And so she'll be joining us as well. And they will be talking about that upcoming conference, which is going to be held in Rwanda from the 13th to the 15th of December. Also online today, we may be joined by Dr. Merawi, who will be supporting Dr. Ogwell through this briefing today. So that's our exciting lineup. And of course, as usual, immediately after that, we will then go into our question and answer section. But for now, let me hand you over to Dr. Ogwell, who is going to be giving you the brief and the rundown of COVID-19 and other public health issues on the continent. Dr. Ogwell, it's over to you.
Thank you very much. Wayne, good morning, good afternoon. Good evening, wherever you're joining us from. And I'm really pleased to welcome His Excellency Dr. Daniel Ngamije, Minister of Health of Rwanda, to join us in the press briefing today, and Professor Agnes Binagwalu, who is co-chair of our conference for International Conference for Public Health in Africa, which we are holding later on today. And they will be able to give us just a little bit more information how those preparations are going. So let me start from our side with the summary of the public health events of significance on the continent today. We have about 8 or so different public health events that are significant, but in total we have 21 that are going on the continent. And as we've discussed before, quite a number don't reach the press, but we still deal with them on an active basis. And today I want to give you a summary of 2 of the 8, and that is COVID, and then the Ebola virus outbreak in Uganda, before we shift to the Conference for Public Health in Africa. So as of today, we have documented on the continent of Africa just over 12.1 million cases, and 95% of these have recovered. And unfortunately, we have lost 256,128 individuals on the continent. The case fatality rate we are seeing on the continent for COVID stands still at 2.1%, which is nearly double the global average of 1.1%. So although our numbers are lower, we have seen comparatively, in proportion to the number of cases that we've documented, slightly more deaths than have been seen at the global scale. Now, let's see how we have, when we compare epidemiological week 46, and this is the week of 14th to 20th of November, we compare that with the epidemiological week 45, and that is the 7th to 13th of November. We see that in the new week, we have documented a total of 9,101 new cases of COVID-19 on the continent. And this is a 17% increase from the previous week. We are also seeing that all across the continent, the different regions of the continent, the increase is very comparable, as in each and every region is affected during this new week. When we look at the number of deaths, though, we have documented in this new EPI week a total of 42 new deaths, 42 new deaths. And this is a 36% increase when we compare to the previous week. Now, when we look at the 4-week trend, that is comparing the current 4 weeks, this is 24th October to 20th of November, with the previous 4 week, we see that the number of new cases has increased by 18%. So there is a sustained gentle increase in the number of cases being documented. And when we look at the number of deaths also, during this 4-week period, we are seeing a 24% average increase. So in general, on the continent, we are seeing an increase in COVID-19 cases. When we look at the past 4 weeks, we are seeing a few countries who may have the possibility of beginning a new wave, but we want to look at that for the next 2 or so weeks to see if it is a sustained wave or what we know in terms of control will come into play, and we'll keep those numbers low quickly. For vaccination, so far we have received 1.034 billion COVID-19 vaccine doses, and we have administered 799 million, which gives us a 77.3% administration rate for what we have received. So the numbers are going up, which is very good. The total coverage of fully vaccinated on the continent, for when we use the full population as the reference, then we are 26.11% of the total population. And this means that we have already vaccinated 363 million people on the continent since we started this vaccination campaign. And over the past 2 weeks, we have vaccinated an additional 13.7 million people across Africa. For booster doses, we still stand at 2.9%, and this means that nearly 41 million people on the continent have had their booster doses. We continue to support our countries with the COVID-19 vaccination campaigns. We continue to secure what we need for the campaigns, whether it is actual vaccines, it is the consumables that we need, it is experts that are going to support the countries, or whether it is communicating with the public in a way that encourages them to come through and get their vaccine, their COVID-19 vaccines. We continue to support all our member states who are in need of that support. Let's move to a summary of the Ebola virus outbreak in Uganda now. Since the last brief, the good news is there have been no new confirmed cases or deaths of Ebola virus in Uganda. And I repeat that it is significant that since the last briefing last week, we have not documented any new confirmed cases. Neither have we documented any new confirmed deaths as a result of Ebola virus disease in Uganda. This means that the engagement that the government, supported by a cross-section of partners, including Africa CDC, has been doing with the public is showing results, and we are quite encouraged by this trend. Particularly looking at the high level of community engagement after we deployed the village health teams across the affected areas. Right now, the last confirmed case was reported on the 14th of November. And we very cautiously begin the countdown of the last case that had been documented. But cumulatively, from the beginning of this Ebola outbreak in Uganda, we have 141 confirmed cases and 55 confirmed deaths across 9 districts in that country. And this means that we have lost about 4 out of every 10 cases that have been confirmed to have Ebola virus disease during this particular outbreak. Those are still too many people, considering that we have a lot more knowledge how to manage these outbreaks if they are discovered early enough. And the tools that we need, particularly for this strain of Ebola virus, are still not adequate. We don't have rapid tests. We don't have vaccines. So it is work that we need to continue to do to ensure that we have the full suite of tools that we need for the Sudan variant of Ebola virus disease. On a relatively more sad note is to note that quite a number of healthcare workers have been affected by this particular outbreak this time. 19 cases that we documented of health workers, 7 of whom unfortunately passed away in the line of duty, something that we need to ensure doesn't happen into the future. We are documenting very well areas that will need to be addressed to ensure that our health workers are fully covered during their work in the front lines, supporting and treating our populations. In summary, for Uganda, is coordination is playing a very big role in ensuring that the numbers are coming down. All partners who are supporting the government are using one plan. We have all been contributing to different synergistic aspects of the response, and the government is fully in control of that, and we're very happy as Africa CDC to be providing support in laboratory areas, in infection prevention and control, in community engagement, sending out the village health teams to do good surveillance, and of course, by supporting the neighboring countries depending on which areas that they need support. So Wayne, these are the two specific updates that I wanted to share today before we move the discussion to the Conference for Public Health in Africa, and invite the Minister and Agnes to provide us with their updates. Thank you very much, Wayne.
Okay, thank you very much, Ahmed, for that breakdown. Colleagues, as I've mentioned, we have the Minister, the Honorable Minister of Health for the Republic of Rwanda, Dr. Daniel Ngamije, and we're also being joined by Professor Agnes Binagwalu, who is the co-chair of the scientific committee of that conference that will be happening in Rwanda in December. So they are online, and it is a great pleasure right now for me to invite the Honorable Minister, Daniel Ngamije, to give us his breakdown of that particular conference. Honorable Minister, it's over to you.
Thank you, Winnie. Professor Agnes, co-chair of the conference, and Dr. Ahmed, I'm pleased to be with you on this call for the brief related to our conference. So good morning, good evening, participant, wherever you are. We are really pleased to be on this call, trying to give you most updated information regarding the conference. So as you know, this is the second international conference on public health. It is co-organized by Africa CDC in the partnership with the Ministry of Health of Rwanda. The conference is planned to start on 12th up to 15th, but there is a youth pre-conference, which is also planned to start on 10th December. It is an interesting event, as you might anticipate, by reviewing the content of the conference. With 9 tracks with very interesting themes, starting with the track 1 in relation with the epidemiology, diagnostics, and the clinics management. We want to go through what we did and were able to do in most of our countries to reinforce our surveillance system and build capacity for diagnostics, for actual pandemics that we are facing, but also in the future, those pandemics that we expect. Part of the response is local production of commodities for diagnostics, therapeutics, and of course, vaccines. And we'll have a track on it with different experts to tell us where we are in this process of building local production capacity in our countries. We were able to see that for a comprehensive response for COVID, and even now with Ebola in Uganda, you need a very strong, resilient health system, which allows to go for universal health coverage. We believe that we have a lot to share among participants and with experts who will join the conference. There is an interesting track related to women who are victims of these pandemics, more than probably male for different reasons. And they are there as a recipient of intervention that we are doing in most of our health systems, but they are there also as provider of health services. And they are there also as the leaders. That's the reason of having two co-chairs of this conference, which are very known professors, Professor Agnes and Professor Senait. And we have a lot of other ladies who are in strong position regarding public health interventions in Africa. There are some enablers factors that through this conference we'll go through, and we use those enablers factors during COVID. Digitalization of our health system. We should go with technology, with all new development regarding technologies. So digitalization of the health sector, it's a strong enabler factor that we should discuss and see how we can customize it for the benefit of intervention in our countries. Another key enabler factor that we'll discuss is this wide stakeholders engagement. The community, the public sector, the civil society, but also the private sector. This wide stakeholder engagement is a strong track that we review and see what we can learn from each other. And finally, there are things we can't forget because they're there and unfortunately they remain for long. We have these long-standing infection diseases, HIV, TB, and malaria. We face the risk of disruption of services as we are fighting COVID. We need to learn how we should avoid disruption of services if we need to manage any pandemic. NCDs, they're also there as a new public health challenge. Incidence of NCDs is increasing. So as we fight pandemics, as we are prepared for future pandemics, we need to make sure that we keep providing services for the prevention and the control of non-communicable disease. So I think all these themes, which will be part of the agenda of the conference, there is a lot we'll learn from researchers, scientists, policymakers, civil societies, organizations. I think we can't miss this conference with all these themes that will be discussed. In addition to that scientific component, then we'll enjoy Rwanda, we'll enjoy Kigali. We have a lot of social events. We'll have Kigali Night Run, we'll have a tour for Kigali. We have a lot of social events that you will discover. We'll make sure that the agenda is quite light to allow you to go out of the conference sittings and see out of Kigali Convention Center how look Kigali. And of course, it will give an opportunity for a lot of interactions and build new partnerships. Given a lot of side events that will be organized, I can assure you that people who will be attending these 3 days, they will have a lot to share, to learn, to build term of relationships. So I just want again to invite all participants and request that you register and attend the conference as soon as possible. You're welcome in Kigali. We are excited to give you good time. You'll have a nice experience in Kigali during this conference. Thank you, Winnie.
Thank you very much, Minister. And colleagues, you will have noticed that NECE has posted the link for you to register for that conference, and you can find it on the chat. All right, so now it is time for us to move on and give the floor to Professor Agnes Binagwalo. And as I've said, she is the co-chair of the scientific committee of the upcoming conference. Prof, it's over to you.
Thank you, Winnie. Good, I don't know what time. I'm in the US, it's the middle of the night. So I guess I'm going to say to everybody, good morning, Honorable Minister and everybody. So my update will be very brief and rapid because the conference, the preparation is going very, very well. I follow it as a co-chair. I co-chair with Dr. Senait. And the people in charge are a team, a joint team from CDC Africa and from the Ministry of Health in Rwanda. We are meeting every week and everything is on track. We have all the speakers have confirmed, and more than 70% of abstract and speakers have confirmed. The last response are waiting for today. And we have alternative where we don't have yet an answer. So now the team on the ground that are preparing it, the conference, side event, and all the major events are really on top of everything. As a co-chair, I can just say I'm very happy. Well organized, dedicated team. Coordination is very good under the team of the Ministry of Health with the support of CDC Africa. So very, very, very promising.
All right, thank you. Thank you, Prof. Colleagues, it's time for us to have our question and answer section. I'm not seeing any hands going up, so I'm just going to be giving you the contact details for you to send in your questions. And that is our usual WhatsApp number, which is +251 94 550 2310. Let me come back again with that number. It is +251 94 550 2310. But you can also send in your questions through the question and answer platform, as well as come through live. So while we wait for you colleagues to send in your questions, perhaps let me give 1 or 2 minutes to Dr. Merawi in case there is some additional detail that he would like to add. Dr. Merawi?
All right. Thank you, Madam. Good morning, good afternoon, colleagues. So just to give a brief, I think Director have already addressed some of the critical components. But in addition, I think Africa CDC is planning to train over 800 laboratory workers on biosafety, biosecurity. This is one major component which will start next Monday. And we are also in preparation for next Monday to deploy around 2,000 village health team, which is really very critical in contact tracing and tracking of all health events, especially. And we are also closely working with the ministry on sustainability of some of these interventions beyond this ED response, and also in preparation for the upcoming festive seasons. Just to add these two components. Thank you.
Okay. Thank you, Dr. Merawi. I'm just checking our platforms to see if we have any questions. I'm actually not seeing, all right, so I've just seen, just give me a second. Let me check if we have anyone wanting to ask a live question.
Wayne, I could add 1 or 2 things here.
All right, okay, please.
Yeah. So first is all the time we're on this platform, we come with a lot of discussions around diseases, health emergencies, and generally relatively sad stories. And today we've come with a very happy story. And when I hear my brother, Minister Daniel Ngamije, saying that everything is set, not just for the formal part, but also for the informal part, it's a very happy story that we're bringing today. And when I listened to Professor Abinagwaho about how all the arrangements on the scientific side are all on course, we are very pleased as Africa CDC that we can be able to come and discuss something beyond our core mandate, which usually is health emergencies. Second thing that I would like to share is really the need for the continent to rally around our events, whether they are a conference like this, whether they are trainings that we are conducting across different countries, whether it is planning, really African events, African activities, African institutions is really what is going to ensure that we are resilient enough so that next time any outbreak comes, we are able to arrest it quickly and contain it, or any time there is any challenge on the continent, the need to generate evidence, to share it, then we have our own platforms that we are using here on the continent, and very effectively at that. So it is a very happy discussion today. Thank you very much.
All right, thank you. I'm sure that
Dr. Mohammed, if I can add something, if you remember the pillar of creating this conference in the beginning is to really show to Africans first, to our people, to our on the continent, what the continent is capable to do, what the continent is, what we have and what we miss. So it's very important to don't forget that. And also how, by creating a resilient health system based on primary care, we can build the health sector on our continent. So the objective was also to celebrate our achievement, because as researchers in Africa, we always go around the world saying what we do. We don't do that at home. We don't share that with our junior researchers on the continent. So we really need to insist on what you have just said, that the objective of that conference is to take stock of where we are, what we can do, what we can transmit to the junior researchers, and where we need to make effort for the next steps.
All right. Thank you. I see that a question is coming in, and it is coming in from Lucia, who is working with the Sub-Saharan African Bureau of the International Spanish News Agency. And I think this is Lucia Blanco. So she says, I reach out to ask you which African leaders are expected to participate in the upcoming CPHI in Kigali. So perhaps I could put that to Prof.
The Secretariat is better placed to tell us where the invitation have been sent, yes. Who has answered so far? The Secretariat is better placed to answer that.
All right, so Ahmed, I'll put that question to you.
Yeah, thank you, Wayne, and thank you, Lucia, for that question. Let me start from the end. The end is we have planned for all levels of leadership on the continent that will be able to make it. And the host country can be able to give a confirmation for that whether it is heads of states or ministers, heads of the different agencies, institutions, not just on the continent, but globally, whoever confirms to come, we are ready for that. Second is we have invited heads of, are not able at this stage to share names until confirmation confirmations have been done. We invited heads of different institutions that we work with on a regular basis. So the whole leadership in public health, and both at the technical and political level, we have made these invitations, and we continue to receive confirmation. So I think closer to the conference, we will be able to share after the confirmations have come in, who exactly will be able to grace the event. Let me add here that we have made provisions for a remote participation, but we are encouraging everyone to come to Kigali. It is much, much easier, much better for you to be there in person, but we will be making provisions for live streaming for those who may not be able to attend in person, particularly you as journalists. But closer to the event, we will be sharing specific names, but right now we are ready, and we have planned for every head of state, every minister, every head of institution that will be able to come to Kigali for the conference. Thank you.
All right, thank you. There is a hand up that has just, okay, it has disappeared, but it was Eliza Ange. So Eliza, if you're having difficulties with the live connection, you can send in your question. So while we wait for that question from Eliza and or any other colleagues, there is the issue of the discussions that are happening in Niamey with regards to the Africa Continental Free Trade Area. And I think that value chains and things like that will be discussed. So perhaps Africa CDC, Dr. Ahmed, you can also just highlight for colleagues who are online the importance of that kind of conference and how it links in to the objectives of Rwanda.
Sorry, thank you very much, Wayne. So the summit that is happening in Niamey this week into the weekend is on industrialization, and of course the African Continental Free Trade Area Treaty and its implementation. A very core part of both sides of this coin, the industrialization and then the trade, is linked to our work as Africa CDC, work as ministries of health when we deal with health emergencies. Health products that are required for routine work and for emergency work are largely imported into Africa. And we have the ambition of manufacturing locally here on the continent all the health products, or as much of it as we can. That's why the industrialization part of the summit is key. And Africa CDC is fully represented, and we have a message for the summit on industrialization where local manufacturing falls. On the trade part of the summit, where FCFTA is presenting some proposals, again, Africa CDC is fully represented because we believe strongly that we should not be importing masks. We should not be importing PPEs, because we have already shown we can be able to manufacture them on the continent. And if we can manufacture them on the continent, it means we can trade them on the continent. So on the trade part of the summit, we are encouraging our member states to manufacture everything from the simplest to the most complex, like vaccines, and then we trade them using the platform that has already been established by the Continental Free Trade Area Treaty. So on the trade part, we are also sending that very clear message that health products, particularly those we use in health emergencies, are a very key part of the trade when the trade begins. We would like this to be one of the very first things that we do. But I would like to invite Minister Ngamije to speak a little about what Rwanda is already doing with in as far as manufacturing is concerned, because this links also directly to the discussions that are happening in Niamey this week around industrialization and the trade part. Minister Ngamije, please.
Thank you, Dr. Ahmed. It's true that as I was presenting the agenda, in summary, I talked about local production of health commodities, therapeutics, drugs, vaccines. And as you know, we, as the government of Rwanda, we are in partnership with BioNTech for manufacturing vaccines, in mRNA vaccines in Rwanda. It's a process. The process is going on. What is interesting is to see how, by setting conducive environment, especially with a stringent regulatory agency for drugs, it will attract and allow investors to invest in local production of these medical commodities, pharmaceuticals, because if they are produced in a country where there is a stringent regulatory agency, there is chances for having it exported and attracting potential funders, especially international funders, to buy this product and distribute this product in Africa. During time of COVID, we came to realize how we're very fragile, very depending on what was produced abroad, from even simple items like masks and coverall and tests. There are things we should fix from now. Then we need to set conducive environment if we want to be prepared for future pandemic, for manufacturing some of these items, and then being enough ambitious to the point of planning even producing vaccines. By the way, as you know, this is the Africa Union agenda goal for having by 2040 manufacturing a good number of vaccines in Africa. So if you want really to reach that goal, there is a lot to do on scientific part of it, but also key investment regarding infrastructures, human resource, regulatory agencies. All these are part of a package that we should be discussing. And I'm happy that in Niamey, the Summit of Industrialization and Trade, of course, is fed with what we want to do and achieve as Africa by investing for local production of pharmaceuticals. I think it goes with that vision of our head of state to reduce progressively the way we depend with external produced commodities from abroad. Yeah.
All right, thank you. Eliza has managed to come back. Eliza, good morning. Please tell us your news agency, ask your question, and also advise to whom it is directed. Eliza, hello. Okay, yeah, I think maybe Eliza is having some challenges coming through. Prof, did I see your hand up? You are muted, Prof.
Sorry, I try to be disciplined. It was simply to highlight the importance of what Honorable Minister and Dr. Hamed have just said now, and that we insist on that for two reasons. It will push researchers, African researchers, who go outside the continent to serve other continents, to try to find their place here. So this conference, Professor Ahmed and Honorable Minister, should be also a convening of high-level researchers or that are of African origin, even if they have took other nationalities for convenience of life, to attract them to come back in Africa, because they are needed. And if you can have a list of them and invite them just to be hosted for the conference, it could be a very good booster for the medical health researchers on the continent. Explain to them that they went out because Africa was not ready to use them at the level of technicity they were, but now Africa is ready.
All right, thank you, Prof. I will give Eliza one more try to see if we can get to talk to each other. Eliza, good morning.
Hello? Yes, can you hear me?
Very clearly, please go ahead.
Perfect. I'm sorry, I was having, my mic was having issues.
Okay.
I wanted to bring Honorable Dr. Ngamije back to the manufacturing of vaccines in Kigali. So since last year, I'm looking for an update. We saw partnerships and agreements signed between Rwanda and BioNTech. And according to officials at the time, we were supposed to see action by July last year. But I'm wondering if there's a fresh update, and if have you had any challenges that came in the way of that? I'm also wondering if there are any new partnerships. Last weeks ago, we saw the Prime Minister of Barbados here in Kigali talking about manufacturing vaccines with Rwanda. And I would like to understand, is there an update from last year's agreement? Do we have any new partnerships? And is this conference going to bring anything new or any new partnership? And I would also like to have any update, a fresh update on how Rwanda is prepared, or the current steps to keep Ebola out of Rwanda. Since we are having this conference, I would imagine that it's going to be tight. So really just updates. Thank you.
Okay, Honorable Minister.
Thank you, Ange, for your questions. So we are implementing our roadmap that we agreed with BioNTech as far as our partnership is concerned. As you might be suspecting, you can't overnight complete a factory for manufacturing vaccines since we signed the agreement with them. So everything is on. It's like we are well implementing the roadmap as planned. We have some key milestones to achieve. They started already. I can see that you are from Rwanda. So in the area where the construction is planned, work started, and it's beyond only works, because there is a component of human resource capacity building. That component also is part of the process for having Rwandans who will be working with their colleagues from Germany. So all this process, we're working on human resource capacity building, but also there is a legal framework for getting some laws voted regarding clinical trials. We are doing it already. And of course, reinforcing Rwanda Food and Drug Authority as a regulatory agency, as I said it a few minutes ago. So all these components, we are fixing them. I believe that let's just wait and see what will happen in coming 2 years, as agreed with our partner. I can tell you that already having the partnership with BioNTech, we do have potential partners who are willing to come and invest also for locally manufacturing some commodities which will be used for the administration of those vaccines. We have interested companies from different continents. So the ecosystem is in place progressively. I believe in the future, you will see all this piece of puzzle together when we'll be starting to manufacture vaccines, but also pharmaceuticals, products, and other commodities. So for Ebola, we are prepared. We are doing, in partnership with Africa CDC, WHO, we have a plan for the prevention of cross-border transmission from our neighbor. We have what we need to implement regarding internal plan that we agreed in EAC region, but also with the support of Africa CDC and WHO, as I said. So it's good that already we are getting good news from Dr. Ahmed that for now recent new cases, but we keep vigilant. We are very vigilant as any other country in the region. This is a normal process, and we are closely discussing with our colleague from Uganda. We have a platform where we get information from Minister Ruth. So you can think that we are safe so far, and we are doing whatever is possible to contain the pandemic. But if it arrives, we are ready to fight and to face cases if we have any single case in Rwanda. Thank you.
Okay, thank you very much, Minister. It is now time for us to hear the main headline points.
Let
do you want to make an addition?
Yes. Let me add something. Very important questions that are being asked there. I think let me start from the end about Ebola. It's not a major concern for the conference because, as the minister says, everything's in place. In fact, during my briefing, I was saying that we are strengthening the neighbors' surveillance capacity so that nothing slips through. So Ebola is not one of the major concerns for this conference, and we still are going to hold it in person because everything is in place. But the question around which touches on High Excellency the Prime Minister of Barbados, who was in Rwanda recently, you may recall that during the COP27, there was an event that brought together Africa and the Caribbean countries. There's a very close collaboration that's going on between African countries and the Caribbean. Indeed, ourselves as Africa CDC and the CARICOM Secretariat, we are working very closely so that what we are doing on the continent has a direct positive effect in the Caribbean as well. You may also recall that during our negotiations as the Africa Vaccines Acquisition Task Team, and Caribbean countries were part of the African negotiation bloc. Whatever we negotiated was also available to the Caribbean countries. So we are very, very close in that way. And looking at the manufacturing ambition, a decision has been taken that Africa and the Caribbean are going to be working together to take the manufacturing, not just of emergency products, but also non-emergency products. The routine products are going to be a part of this. So a lot will come out of this particular collaboration that you're seeing in a very positive way for Africa and also for Barbados. And finally is to reassure not just Eliza, but the whole continent, indeed the world, that the plans that Africa has put in place, and I'm talking about the whole continent, not just Africa CDC, and not just the government of Rwanda and all those front-runner countries that are doing quite a lot in as far as expanding the vaccines manufacturing enterprise is concerned. But the whole continent is now adjusting itself to be able to identify its priorities and manufacture them on the continent. This decision has been taken, the process has begun, and you will see and hear a lot more in the coming weeks and months around the concrete plans that we have to manufacture specific items here on the continent and to ensure that we have access to what we need. So that decision has been made, and we are going to be progressively implementing all these. And the conference is going to discuss some of these issues in some detail, and we are looking forward to our experts giving recommendations on where we can be able to increase the momentum. We are looking forward to all of you being in Kigali in December. Thank you.
All right. It's time now for us to bring our press briefing to an end for today. And as usual, we will give 2 minutes each to the panelists to perhaps just give us the headline points that they would most like the media to take away from the briefing today. So let me start with Professor Agnes Binagwalu, your summary on the issues around the conference before we hand over to the minister and then end with Dr. Ahmed.
Thank you to all of you, because I'm a very, very happy co-chair, and I can talk also on behalf of my other co-chair, Professor Senait, who was not able to join us for this time. She's traveling. Things are going very well, as I told you, in our point of view. It's a very good continuation of what we did last year. Last year, it was not a face-to-face because of COVID, so it's going to be the first time Africa, the public health actors in Africa are coming together as a continent. So for me, what I can say to the press, this is a great moment. Normally, never forget, we all go outside the continent to say what and to expose what we do. This time we are coming as a continent in our continent to do it with 3 years delay because of COVID, but we are doing it and at a very good time, at a time when the continent is talking about to boost our health workforce, because we need more in all the area of the workforce. We need to increase the quantity, the quality. So this conference will have an impact on all this. Workforce, researchers, manufacturing, and it's the first time also that we will come together as a continent around that during this period, because it's not the only conference. You understand that there is one coming this week that will also englobe, concern that. So it's very exciting. The press should support it, disseminate it largely, because it's very good that the health professionals, the health researchers, the health educators are informed and really ignited and enthusiastic by that.
All right. Thank you, Prof. Honorable Minister, your key points.
Thank you, Winnie. I just want to recall the theme of the conference, which is about preparedness for future pandemics and post-pandemic recovery. We are not yet out of COVID, but we're able to contain it and respond properly as a continent. We have a lot to share. This conference will be an opportunity to bring together scientists, researchers, policymakers, public sector, private sector, community organizations. Everybody will be here to share and to learn a lot of what scientists will be publishing, what they will be presenting as findings of their own researchers. So we should not really miss this opportunity. Number two, the social component of the conference is well cared. You will not be bored. We make sure that we have nice time, nice experience in Kigali. As I said, the schedule is arranged to facilitate this nice experience of your stay in Kigali. And finally, given the number of people will be attending, from potentially some head of state, ministers, scientists, and private sectors, you have opportunity for making business, for making partnership, new partnership. So you have a lot of people in the same place, so you can target whoever you want to partner with and start new business with, depending what you do, either in pharmaceuticals area, as a scientist, people from universities will be here. Please be here. You are welcome. You will enjoy. You are staying in Kigali.
Thank you very much, Minister. Now, finally, let me give the floor to Dr. Ahmed.
Thank you. Thank you very much, Wayne, and thank you, Professor Agnes. Thank you very much, Minister Ngamije, for joining us today. Thank you very much. Merawi is leading our Ebola virus outbreak in Uganda. Three things that I would like to share in summary. First is on the conference. I think both my co-panelists have made a very impassioned plea for you to be there. The only thing I will add is a beautiful Swahili saying that goes, "Kosa uchekwe," which means please don't miss it. Don't miss it. Don't miss this conference. A lot has been put together there. Second is on COVID. Vaccination rates are going up. We are progressively adjusting the way in which we are presenting our data, and our focus in the coming weeks is going to be specifically the group that is 12 years and above, and our data will also reflect exactly that, 12 years and above, rather than the whole population, because we can't vaccinate newborns. So we'll be focusing on 12 years and above, but we are urging everyone to get out there and get vaccinated so we can bring COVID under full control. Finally is the outbreak in Uganda. The government has done a very commendable job. The partners are providing very good support, and we are asking for understanding as we try our best to wrap up this particular outbreak. In Uganda, the numbers are showing us that what we are doing is working, but we must remember that the virus is with us all the time. And the virus is usually not the problem. The problem is when it starts circulating in the wrong place in large quantities. That is when it is a problem. But otherwise, all these viruses are with us. If they are contained, they are not a problem. If they are not contained, then they become a problem, and we don't want them to become a problem. So bear with us as we continue to bring this latest outbreak under control. And finally, Wayne, is to say a very big congratulations to the government and the people of Rwanda. They were selected to host the Africa Medicines Agency, which is a sister institution of Africa CDC. And we are really looking forward to that agency playing its part in not just the manufacturing we have talked about, but also in supporting all the countries on the continent in emergency preparedness and, when required, during emergency response. So very big congratulations to Rwanda, and we are looking forward to the African Medicine Agency joining the Africa Union family of institutions to strengthen the way in which the continent prepares, responds, and becomes resilient when it comes to public health emergencies. Otherwise, thank you, Wayne, for all the moderation and for those who are participating as well. Thank you.
All right. Thank you very much, Ahmed. Let me thank colleague communicators who joined us online. We had quite a number of you listening in, and I'm sure that you're going away with a lot of very valuable input. Now, let me thank the panelists, Dr. Daniel Ngamije, who is the Honorable Minister of Health of Rwanda, Professor Agnes Binagwalo, who is the co-chair of the Scientific Committee of the upcoming conference, Dr. Merawi, who is with Africa CDC, and Dr. Ahmed Ogwell, who is the acting director of the Africa CDC. Gratitude also to all colleagues behind the scenes who manage this particular program from the African Union and from the Africa CDC. So let us make a date for next week at the same time for more on information, advice, and guidance on public health issues on the continent.
Recording stop.